Hello, everyone. Thank you so much for joining. We'll give another minute or two for everyone to join, so we'll be getting started momentarily. Welcome, everyone, to today's CDC Model Aquatic Health Code Network webinar in the implementation of the MAHC, the Model Aquatic Health Code in Pueblo County, Colorado. It's a pleasure to be here, and I'm joined today with several colleagues that will be sharing a lot of great information with all of you. So before we get started, just a few reminders. This webinar is being recorded, and we will share the recording along with a copy of the slides afterwards to all registrants. Also, you're welcome to submit any questions that you have throughout this webinar via the Q&A box that you can find at the bottom of your screen. And we'll have plenty of time at the end to go through your questions, and you can ask our panelists. So with that, this is our agenda for today. After some welcoming introductions, we'll share with you some of the Nature MAHC resources that we have, where you can access our past webinars and some of our upcoming resources. Then we'll pass to our Pueblo County colleagues. They will be sharing with you how they adopt and implemented the MAHC. And then we'll go through some questions and answers at the end. So in case you haven't met me yet, I'm Daisy Galan. I am a lead program analyst at NACHO, the National Association of County and City Health Officials. We hold these webinars every 3 to 4 months. So if this is your first time joining our webinars, welcome. We have our link here in a minute where you can learn much more about what we do at NACHO. And you also have our email address here at the bottom in case you need to contact us afterwards. But with that, I will pass it on to my colleague, Rebecca Rainey, to introduce herself and share much more with you.
Thank you, Daisy. Hi, everyone. My name is Rebecca Rainey. I am a program analyst here at NACHO, and I work on our environmental health team on all water, sanitation, hygiene, and aquatic health topics. So before we jump into our speakers today, we wanted to take a moment to highlight some of NACHO's Model Aquatic Health Code and just general aquatic health resources. All of these resources can be found on our MAHC network webpage, which, like Daisy said, we'll send out these slides so you have access to this link. So if you check out our MAHC network webpage, we have all recordings and slides from past MAHC network webinars going back to 2018. We have a link to a huge YouTube playlist with all of our webinar recordings going back even further to 2016. We have lots of different resources for local health departments on the Model Aquatic Health Code. And we also have the instructions on how to subscribe to the Model Aquatic Health newsletter. So this is a great way to keep up to date on new upcoming webinars, resources, and more. And one of those upcoming resources, which you should keep an eye out for around September, is a really great written summary that we'll be putting together highlighting Pueblo County's experience that you'll be hearing a bit more about today. So that being said, I'm going to pass it on over to our speakers today. We have Autumn Whitaker and Scott Cowan, who are both from Pueblo Department of Public Health and Environment. They're going to share, like Daisy said, their experience adopting and implementing the Model Aquatic Health Code in their jurisdiction. So I will pass it on over.
Thanks, Rebecca, and we'll get Autumn will be sharing our slides here, so we'll get that up and then we'll get going. So my name is Scott Cowan. I'm the current program manager of the recreational water program here at the Pueblo Department of Public Health and Environment. And Autumn is an environmental health specialist who has worked in the program extensively and also does a lot of work with our CDC grants as well, and lots of other things. So Autumn, did you want to add anything to that?
I think you did a great job. I was just testing my mute abilities to make sure I could do it when it was my turn to speak.
All righty, good deal. So I just want to thank everyone for coming to our presentation today, Making Waves in Pueblo County, a journey through a MAHC adoption. We hope that sharing our experience will help those of you who are interested in adopting the Model Aquatic Health Code in your jurisdiction. Before we get started, we would like to thank NACCHO and the CDC for this opportunity to speak with all of you today. And we're really, truly grateful for the opportunity and the platform they've provided with us to share our story with all of you. So we'll get into it. So for the presentation today, I'll be giving you some historical background about the Pueblo Department of Public Health and Environment's recreational water program, some of the challenges we were facing that led us to exploring adopting the Model Aquatic Health Code. Then Autumn will really go into a lot more detail about the actual process and what that looked like, the impact it had on the operators, including the necessary changes to their operations, and how PDPHE worked to empower them to really ease their making those needed changes. This is going to include the results of some cost-benefit analysis surveys that we did with our stakeholders, as well as some pre and post-adoption inspection data. And then we'll finish up by sharing some of our successes and challenges, talk about where we would like to go next with the program, and then sum up with some takeaway messages from our experience. And then at that time, we'll address any of the questions you may have. So for those of you who are not from Colorado, we want to share a little bit about Pueblo County with all of you. Pueblo County is located in the southeastern portion of the Colorado, so that red blotch on the map there. It's about a 2-hour drive from the Denver International Airport, south on Highway 25. The county consists of approximately 2,300 or 2,400 square miles of land and a population that is about 169,000 people, with the vast majority, somewhere around 112,000 people living in the city of Pueblo itself. Pueblo is the 9th largest city in the state of Colorado, and it is known as the Steel City because historically steel production made up a large portion of the economy, while today only about 6% of our jobs are still in manufacturing, but we have that long tradition. It's also known as the home of heroes because we actually have 4 Medal of Honor winners who were born and raised in Pueblo, which is a really cool fact. Overall, Pueblo is really a great place to live. I was a transplant from the East Coast, and I've been here about 20 years now, and I've really enjoyed my time here. So, so you can go to the next slide, Autumn. So these are just a couple of pictures of that I wanted to share with you. One is of our downtown area, and I apologize, the one is a little blurry, but that's a typical landscape that you would see here in much of Pueblo County. We do have some wooded and more mountainous areas, but the vast majority is really kind of this short prairie grassland. And so most people outside of the state, when they think of Colorado, they get images in their mind of mountains and aspen trees and skiing. And it's a very different environment here in Pueblo County that we deal with, as well as many of the other counties in the southeastern portion of the state. So we have what's known as a high desert climate. We get very little precipitation, only about 13 inches of rain total a year. About 78 to 80% of our days are pretty much full sun. It can get quite hot in the summer, and we're always really constantly under the threat of perpetual drought. And that actually influenced us when we were in the process of deciding whether to adopt the entire MAC or to exclude certain portions of the code, including the portion dealing with makeup water, which Autumn will talk about a little bit more as we go later in the presentation. So next slide, please. So next up are some details about our recreational water program here at the Pueblo Department of Public Health and Environment. So currently we have a total of 48 aquatic facilities spread throughout Pueblo County with a total of about 75 bodies of water. And that number fluctuates a little bit up and down, but really it's been remarkably stable for a very long time. We don't get very many new facilities here in Pueblo. We don't do very many plan reviews. Really, it's working with many of the same operators who have been here for a very long period of time. So of those 75 bodies of water, we have 56 pools currently, 14 spas and 5 seasonal fountains. Of our pools and spas, 30 of our pools operate year round, while 26 are seasonal and operate only during the summer months. All but one of our spas operate year round as well. And then our fountains are all seasonal. So for our program, for the year round bodies of water, we inspect those twice a year for routine inspections. We do the seasonal bodies of water once a year for routine inspections. So that results in about 118 routine inspections a year. Now that number does not include follow-up inspections where we need to go back and correct issues that we identified during those routine inspections that we were unable to work with the operator to correct while we were on site. And it also doesn't include complaint inspections, which at times we can have a fair number of, depending on the facility and what's going on there. So, all right, next slide. And up until we adopted the MAC, like pretty much the entire state of Colorado, we were using the Colorado Swimming Pool and Mineral Bath regulations. Those regulations have really been around basically forever in the state. They received their last major update in 1994. And from a practical standpoint, our inspections really were focused under those regulations, mostly on water clarity, water chemistry issues. Those were really the largest emphasis of our inspections. So using those regulations, we found that we were having a hard time getting some long-term compliance. And that was reflected in our high closure rates, which you can see on that graph. From 2016 to 2021, our routine inspections, we were closing approximately 25% of the pools that we inspected, while our routine spa inspections, we were closing almost 40% of the spas during that time. So we were well above the national average of 13% of pool inspections resulting in closure and 14% of spas. So another issue we had at the time was that came up actually in 2008 was the passage of the Virginia Graham Baker Pool and Spa Safety Act, which did not then align with the regulations that we were using as written. That act required pool operators to take action to prevent drownings by taking steps to prevent drain entrapment. And we had a lot of pushback and a lot of challenge on the local level because this was representing a cost to many of those operators to retrofit parts of their pool where there was some confusion and some pushback because those two sets, that act did not align with with the regulations that we were using. So this really all kind of combined with us starting to really take a look at our program. So next slide, please. And in addition to our high closure rates, we saw a large number of repeat violations and enforcement challenges during those routine inspections at that time. And it made it really difficult to get long-term compliance, which was our goal, because obviously we're not going to be in these facilities every day. So we want these operators really to be operating safely when we're not able to be in there to assist them or to check up on them. So a typical closure for us would involve either sanitizer levels or pH of the water body being out of range. And usually the operators would respond by manually adding chemicals to the pool to temporarily correct those levels. Sometimes this took numerous tries. And then we would go back and we would do inspections. And if we happen to be there at the right time for some of these folks, we would end up reopening the pool. And then we would go back and on our next routine inspection, which could be several months later, we would end up closing the pool again for the exact same issue. For some facilities, this was really a repeating cycle, and it seemed almost like they were passing or failing inspections solely on random chance. It really just depended on the moment we were there, who was in the facility at the time, and what was going on that day. Additionally, we had 3 major incidents from 2011 through 2016 that occurred that really caused us to take a major look at our program and really become invested in doing a major overhaul to try to help prevent these kinds of things from happening again. So first in 2011, we were called in to assist a neighboring county with a cryptosporidiosis outbreak that was linked to a municipal pool. That outbreak spilled over into Pueblo County residents who had swum in the facility at that time. And there was a lot of concern that that was going to then be spread over into some of our facilities as well, because they came up again and then they swam in our pools. And so we did a lot of outreach and a lot of work with the operators to really address that. We also had a Legionella or Pontiac fever outbreak in 2013 that was linked to a spa in a local hotel and was caused by issues in the ventilation system in the pool room. And we actually went in there and sampled for Legionella, and we had samples really throughout that aquatic facility that tested positive. 3 people became ill during that outbreak, with 1 individual actually developing pneumonia and was pretty seriously ill. Lastly, we had a very tragic incident at a local mobile home park where we had a 3-year-old, a 6-year-old, and their 17-year-old babysitter all drowned while swimming. And this was just absolutely horrifying incident that affected the community greatly. And we really wanted to look at how we could assist these operators in preventing these types of incidents from happening again. So that really led into a really deep dive into revamping our program so that we could help the operators in our jurisdiction. So next slide. And so enter the Model Aquatic Health Code. So as we started to explore those options at revamping our program, we started really hearing people talking about the MAC for the first time. And so we began to research it further, and we really liked what we saw. First off, the MAC was based on the latest scientific data, which was detailed in a 270-page annex that came with the code, which was great. I mean, that was really fantastic for us. And it helped in those situations where we're trying to educate an operator on why those regulations exist. And so we really like that a lot. It's published by the CDC, revised in 3-year cycles. So we knew it was always going to be updated as there were new advancements in the recreational water industry and in regulation. And there was a large focus in the MAC on reducing injury and disease outbreaks, which was exactly what we were looking to address based on those incidents that we had dealt with fairly recently. And next slide, please. And some of the other advantages of the MAC that made it really attractive to us was it would bring our program in line with the Virginia Graham-Baker Pool and Spa Safety Act, as well as other national standards. It would improve our ability to make database decisions for addressing risks due to the increased number and inspection points that we would be looking at during a routine inspection. And this would really then go on to help us make those decisions where we could categorize the issues that were of greatest risk and address those specifically. So that really served as that springboard for overhauling the entire program. So finally, the MAC is continually being reviewed and improved by a wide range of stakeholders, not just including regulators, but also those industry experts and the operators themselves, which we really liked as well, because sometimes, you know, the people doing the work on the ground, they see those challenges that we may not see as regulators. And they see what's actually practical and what works with that real hands-on experience in both the industry realm and then in the operation realm as well. So for all those reasons, we really thought the MAC was a good fit for us, and that led us to exploring it further. So with that, I'll turn it over to Autumn so she can dig into more details about that process.
Thanks, Scott. So we want to give a quick kind of timeline as to how long this process has really been occurring. So it started back in 2018. where the third edition of the MAHC was released, and our team began looking at that and seeing it as a viable option for what we wanted to adopt and change our regulations to. We also started attending a Colorado regulator group that was meeting about monthly, and this is other local public health agencies who are doing swimming pool programs, and so we started collaborating with our partners across the state, so that was really beneficial for us. And then in 2019, we received a grant from the Dr. Neil R. Lowry grant, and that helped kind of push us into getting incentives for our very first stakeholder meeting for the MAHC that we would hold in 2020. So yeah, that first stakeholder meeting happened in February of 2020. And that was our very first introduction to our stakeholders saying, hey, the MAHC it's a thing. We would like to explore it more. We want to get your feedback. And so that's where those stakeholder meetings began. Again, COVID hit in March of 2020. So we were doing this regulation adoption in a pandemic. So we saw a pretty big gap between our next stakeholder meeting, which occurred in November. The same time that year, we received an environmental health capacity grant from the CDC. It's a 5-year grant, and it's really focused on creating a stronger and safer swimming pool program. So again, that's that recreational water program revamp that we were really shooting for, that Scott mentioned early on. In the background, the Colorado State Board of Health had done a rulemaking hearing to adopt or to incorporate the MAHC by reference in the current Colorado swimming pool regulations. So that regulator group that I mentioned that we were meeting with, they and the Colorado Environmental Health Directors Group, they were all doing this background work towards making our adoption possible. It wasn't specifically for us, obviously, but it really helped us in the future when the Colorado Board of Health did vote to incorporate the MAHC by reference in the Colorado Code. So it allowed us as a local public health agency to adopt the MAHC. So that's that really just kind of pushed us into our adoption. In 2021, we really started that work where we started meeting with our Board of Health, trying to gain their support, to let them know that, hey, we're approaching this. We want you to be in the know. We want to get you all the information that you need. And they actually asked for a cost benefit analysis survey to see what the cost would be for our stakeholders as to what it would cost them to do the MAHC adoption. So again, we continued on with stakeholder meetings. We really condensed those July through September to make sure that we were keeping our stakeholders up to date on any changes that were occurring, any future meetings, when the public forum would take place in November of 2021. And that's when our Board of Health voted to adopt the MAHC. And that took place, or that pushed us into 2022 when the Pueblo County MAHC was adopted officially. And that's when a lot of extra work started that I'll talk a little bit more about later. That's when we made our violation library so we could do our inspections. That's when we made our inspection form, because we knew it was actually happening. We were a little afraid to put a bunch of that work in before it was actually adopted. So we do want to be told no and then have invested so much time. So January 2022 really kicked off a lot of extra work. And then our inspections began in April of 2022 after we had that violation library done, the inspection form made, and then we continued with stakeholder meetings from then up to now. And we just recently put out another cost benefit analysis survey to see 1 year after adoption, what was the actual cost for our stakeholders. So we're still waiting on results from that. And that brings us to today, our NACCHO presentation and partnership, and then that'll project us into our NEHA presentation next week. So if you guys are going, make sure to seek us out and ask some questions there. Let's see if I can, oops, I'm trying to advance my slides here. There we go. Okay, so that brings us into some of our major facility changes. One of our main struggles was determining, well, what do we really focus on with our stakeholders? How do we break this into manageable pieces? And so when you're reading the MAHC, you'll see terms such as upon adoption or within 1 year of adoption. So we decided to make our major facility changes focus on those time-sensitive regulations. So those things that were upon adoption were having chemical and pH adjustment feeders in all aquatic facilities. New therapy, wading pools, or interactive play features would also need secondary disinfectant systems, which we don't see many new facilities here in Pueblo County, but historically our interactive play features do have a presence of total coliform. So having that secondary disinfectant system would actually really benefit our play venues here. Diaper changing stations would be required with portable hand washing stations upon adoption. And then existing automated controllers would need to be interlocked upon adoption. Lifeguards and safety equipment were brand new things to our code. Back in 1996, I believe, there was a section in our old code that required safety personnel and safety equipment, but that section was not renewed. So we have no criteria in the old regulations as to what the lifeguard criteria would be, what safety equipment needed to be on hand. So this was all new for our operators, and then requiring certificates of operation was also a little bit new for our operators as well. That brings us to those major facility changes that were required within 1 year of adoption. All facilities by January 1 of 2023 would need to have automated controllers, and those automated controllers would need to have interlocks for no or low flow deactivation. And that's again to prevent any sort of chlorine gas incident in the pool. So your pump shuts down. We want to make sure those feeders shut down as well, because when you're pumping in that acid and any chlorine, that creates the chlorine gas. And once that water does come on, it pushes that gas into the venue. And we wanted to avoid that completely. And then the next thing was having diaper changing stations with a hard plumbed hand sink installed and operational. And again, our facilities typically put diaper changing stations in a bathroom. So having the hand sink nearby wasn't all that difficult. And then that brings us to those options we had for facilities that could not make those changes within the timeframes upon adoption or within 1 year of adoption. We wanted to have grace for our stakeholders. So we wanted to make sure they had options. So we gave them compliance agreements. That gives them additional time for the upgrades. So they couldn't make the upgrade upon adoption. Well, we can give you 6 months. Can't do something within 1 year. Okay, we'll work on something to make sure that you're meeting public safety needs until those upgrades can be made. But it's a written document, so everyone's on the same page. We also gave facilities the option for a variance, and that is only when the facility has an undue financial hardship that prevents them from making an equipment change. And so that's allowing them to work with their equipment as is, but they must also meet the intent of the regulation and ensure public safety. So that was one other option that we gave our facilities. So that kind of brings us into what was not adopted or what was added to our Pueblo County Model Aquatic Health Code. One thing we did not add was anything regarding flotation tanks. We only have one flotation tank in Pueblo County. So that was just a section we weren't quite ready to take on because of the small impact it would have on just the very few swimmers or users of that flotation tank. We also did not include discharge water, and I included the MAHC sections here. So if you guys want to look up all those things on your own, I just added the section number there so you could see it. We chose not to include the requirement for discharge water, and that's for the facilities discharging 4 gallons of water per swimmer per day. And as Scott mentioned earlier, we're in a very high desert, prairie kind of area. We're going through a drought, or at the time we were. So we weren't really sure how to document and record and verify that our facilities were doing that. And that just wasn't a battle we were ready for them to come to us and say, hey, we're in a drought. Why are we discharging all this water? We would cross that bridge when water chemistry dictated that you need to, again, discharge more water, backwash, do all these things. We would work with that as it came up. There's some also stuff in the emergency action plans. As I was reading through the 3rd edition of the MAC, it felt a little redundant. I was reading section 6332 about emergency action plans or EAPs, and then I'd come back, do something, come back, and I'd continue reading, and I'm like, wait, I just read it in 2 different places. So we ended up merging criteria from 6332 into 6345, just so our operators can read all about the emergency action plan criteria all in one spot. So that was one thing we just changed a little bit. And overall, there were about 25 or so like sections, subsections, or criteria that we changed a little bit from the 3rd edition of the MAC. Another part that we didn't quite adopt was section 6.4 to 6.5, and that's all about enforcement and civil penalties. Per our Colorado state statute, we cannot do civil penalties for anything other than retail food. So again, that was another challenge for another day to include civil penalties into our enforcement. It's not a never, it's just a not right now type of thing. And then in addition to that, we added a couple of imminent health hazards from our old regulations, and that's including testing for interactive play features for total coliform water samples, that's surface sampling, and then having a maximum water temperature of 104 degrees. That was something that was in our old regulations, and we thought it was important to include it in our new regs. So Scott also mentioned a cost benefit analysis. I mentioned it earlier as well. This was required from our Board of Health just to make sure that we weren't bombarding our stakeholders, that we had some more background information. So we put out a survey about certain MAC equipment. It's the stuff I talked about before, the upon adoption, the required within 1 year of adoption. All of those things listed on the left, you have the automatic disinfectant feeder, pH feeder, and so on. That's all the equipment we asked about. And then in the green, you'll have those facilities, the percentage of facilities that have that equipment. In blue, it's those that need it. Yellow means we got an inconclusive response. We weren't really sure what they were trying to say. The responses negated each other. And then in gray, you have facilities that did not need that equipment. So overall, we had 100% of our facilities with an automatic disinfectant feeder. About 50% had that pH feeder. And also the automated controller was split 50-50. And then when we get to the 2+ MAC required interlocks, that's where we got more mixed responses. About 39% of our facilities say that they have those interlocks, 51 said they don't, and then 10% were inconclusive. That's one of those responses was the individual said, I have 0 of these interlocks, but I also have 3 at the same time. So it didn't really make sense to us. So that's one thing. We wish we'd have had more time to go back and ask more questions. Unfortunately, with the mass vaccination clinics for COVID-19 that we had through the end of March 2021 up to when we were required to go back to our Board of Health with these cost benefit analysis responses, we just didn't have enough time to go to every single facility. So we had to put those surveys out and trust that we would get the proper responses back. So that's one of the reasons we couldn't follow up on some of this information. We also had about 1/3 of our facilities say they had the diaper changing units, 1/3 say, hey, we need it still, and 1/3 of them do not serve diaper age swimmers. So overall, this is really helpful to see this information. So one of the other questions that we asked our stakeholders was to give an estimate for what it will cost for these MAC equipment upgrades. And again, that's that same list I just showed you guys. Along the bottom here, we have the different estimate ranges starting from $0 and going all the way up to $20,000 or more. We have about 12 facilities that said, hey, we have all the equipment. It won't cost us anything to do these upgrades. Okay, that's awesome, that's great. We go on to the $1 to $5,000 range. We have about 11 stakeholders that said, yes, it'll cost about this much. And then so on and so forth, and moving on up to that 20,000 plus. We also asked an additional question, like, can you cover this cost or can you not cover this cost? And about half of our respondents said, like, yes, we can cover this. And the other half said either no, or they didn't give us a response. But overall, we took this as a very helpful piece of information going to our Board of Health. And one thing we wish we could have done was go in person again to these facilities and just verify that some of these cost estimates did not include cosmetic changes or unnecessary changes that weren't part of that equipment list that we mentioned before. So some of the responses, the $15,000 plus, didn't exactly make sense to us where some of those numbers were coming from, but overall, the information was very helpful for us and our Board of Health. So this slide, we're breaking down the percentage of non-closure inspections versus our closure inspections. Now, this is taking data from 2016 to 2021. Everything in the green are our routine inspections that did not end in a closure. The yellow 5% there is the closure rate for our facilities that had all of the MAHC equipment that I mentioned in that survey. And then we go into the red, that 13%, that's for our facilities who got a closure and they did not have all the MAHC equipment. And then in orange, we have facilities who did not have a survey response for us. So what we really got out of this chart was that the facilities that did not have all the required MAHC equipment were 3 times more likely to have a closure. And so again, this was very helpful for us to say that, hey, if we can get these pieces of equipment implemented, we can decrease our closure rate. So that was also very helpful with our Board of Health. So that again takes us into our adoption successes. I mentioned our Board of Health, they're very supportive of us. We really appreciate their trust in our expertise and their suggestion to do that cost benefit analysis because it really helped us move forward with confidence in this adoption process. So we really appreciate their support. Grant funding was also a really big deal for us. It gave us the ability to bring on extra staff. That's my position. That's one of the main jobs that I work on is grant related stuff. I work hourly, so I was able to dedicate a lot of time to just focusing on this while my coworkers were out doing the day-to-day, doing the inspections, collecting survey responses. So it was great to have that balance of someone who could kind of hide away in an office for a while, kind of making changes, and then someone who was out talking to stakeholders and collecting surveys and doing inspections. So it was really helpful. And then we move on to our stakeholder support and feedback, which again is invaluable throughout this entire process. We had a core group of stakeholders that were at just about every meeting. They asked questions, which really helped us kind of center and get the perspective of the stakeholders to how some of these regulations were going to affect them. It helped us add a little bit of clarifying information or extra words to our code. For example, I brought a couple words from the annex into one of the regulations for the required equipment for facilities that have 1 lifeguard on duty. They need to have certain safety equipment available in case a swimmer is in trouble, that lifeguard helps them. But then there's another incident. So the other users of the pool need to have some equipment they can use to assist swimmers as well. So I brought some information forward from the annex, but that was directly from our stakeholders needing clarification. So it was really helpful there. And then since 2021, we've also seen, with data that we pulled from 2021, we identified pH as a hazard of concern. It was marked out 28% of inspections at that time. And since we've adopted the MAHC and reviewed our data, we've had a 30% drop in pH violations. So that's a huge success for us, that pH is no longer one of those top or main contributors to our closures nowadays. So that's great news. And then also having inspector morale increase after inspections, because now we feel like we are doing a very thorough job going through and marking the boxes and making sure we're checking all of those violation areas, checking all those imminent health hazards that the MAHC provides for us. And we walk away feeling like we did a great job, a very thorough job in protecting the public's health. So that kind of walks us into our challenges, which you would think after you get the adoption completed, you would think, oh, everything's going to be easy now, where our hard work is done. But new regulations really means a new everything. So that means a new violation library. We work with HS GovTech. They are our database management software system. That's where we store all of our inspection data. We had to work very closely with them to make a new violation library so we could include those new imminent health hazards or the code from the MAHC. And I had never made a violation library up to this point. So it was a huge learning curve for me. I really relied on this MAHC cross-reference guide for aquatic facility inspections. That's what you'll see on the right-hand side here. This is a little snippet of it, and it shows you every regulation that pertains to a specific violation item. In this example, it's enclosures, and it goes through chapter 4, 5, and 6, and shows you every section that pertains to enclosures. So I really relied heavily on this document to determine what violations would be on our inspection form, and then what like predefined comments or specific violations you can mark out of compliance for that inspection form item number. So that brings us into our inspection report form. Once we have that violation library done, we're going to make our inspection form based off of that. We went from 33 data points on our inspection form to 68. So that was very helpful for us to begin collecting a lot more data. We also made inventory logs, chemical logs, daily checklists for our operators, really just trying to give them as much information about this MAHC adoption as possible and make their day-to-day lives easier. And here I just have the MAHC inspection form on one side and then our inspection form on the right-hand side. So what you'll see is the MAHC has these little red icons for their critical violations, the imminent health hazards. And as you kind of look between our inspection form and the MAHC inspection form, you'll see that we just brought all of the imminent health hazards to page 1 of our inspection report. So you'll see almost word for word everything that we pulled over. So if you guys ever, again, want to take a closer look at our inspection report form, you can see that there is a method behind our madness. We didn't just go rogue and change everything. We just brought all of our imminent health hazards front and center for our operators to focus on those hazards first. And then page 2 is all of our non-critical violations, which again, almost word for word, all those other violations from the Model Aquatic Health Code side. So again, just a quick overview. So if you guys see that, you'll know what it means. So along with our program revamp, we wanted to really standardize our program. We used the training plan and log from the Conference for Food Protection. Again, with retail food programs, there's generally a stronger regulatory foundation for that program. So we wanted to kind of use that as a template for our rec water program. We didn't want to reinvent the wheel. So we actually took snippets of the training plan and log from the CFP, and we turned it into a recreational water training plan. And that's been really helpful as we trained new pool inspectors on the MAHC inspection. So it's been really exciting to make that happen. We're doing it for like childcare and body art. So we're really standardizing all of our programs across our department. So that brings us to what pre-MAHC strategies have changed. We've changed some enforcement strategies and procedures for our closures and follow-ups. For example, we no longer do like routine total coliform sampling for all venues. We just do it for our interactive play features. We've worked on our compliance agreement and our variance process. We've streamlined some administrative work by using the certificates of operation and billing at the beginning of the year. And we're also tracking total EHS time that's spent on all inspection work in the field or in the office, so we get an idea of how long it's really taking us to do our inspections and where we could become more efficient. So what does the data say now? You've seen some of this data before. Scott talked about the pre-MAHC data in the dark blue, that 25% and 38%. And you've also seen these national closure rates as well, that 13 and 14%. Now, what I want to show you here is like this oh my goodness, let me go back. We want to show you what our closure rates have been several months into the MAHC adoption, which is in the gray. We have 31% of pools as of September of 2022 were being closed, and then 50% of our spas as of September 2022 were being closed at routine inspections. And now what you can see up to date, just a few days ago, I pulled the numbers, and now we're back down to closure rates of 25% for our pools and 39% for our spas. And this is about 15 months of data, 140 inspections. And you can see we've gotten back to our pre-MAHC closure levels, even though we've added, oh gosh, like 16 to 18 plus more imminent health hazards in our inspections. So we're actually seeing, like, our closure rates are dropping despite this rather large regulation change for our stakeholders. So again, I mentioned that we had 140 routine inspections, that I pulled data from, and we wanted to focus on what are the most out of compliance violations. These are violations that are marked out of compliance greater than 20% of our routine inspections. It's how we kind of honed in as to what needs to be changed and educated what we need to educate our stakeholders on. So what we're seeing is proper depth and no diving markers are being marked out 30% of the time, 32% of the time, excuse me. So that's one of our imminent health hazards. That tells us, hey, we need to do more education here. And we'll talk a little bit about that in the next slide. We're seeing that signage, automated feeders, total alkalinity, combined chlorine, all of these things are our most out of compliance violations for our like non-critical violation items. So back in September of 2022, we did a presentation to our state counterparts, and we had 14 violations that we had marked out of compliance, like greater than 25% of the time. So now that's cut in half. We're closing that gap for how out of compliance they are. And so we're seeing some progress here. We're really excited to see this list get smaller and smaller. So we'll talk about some of our grant funded incentives for our stakeholders. I mentioned the depth and no diving markers was something that we marked out of compliance a lot. So we used our grant funds and passed that through to our stakeholders to purchase no diving markers. Again, the temporary sticker ones. We purchased CPR masks and posters, no lifeguard on duty signs, emergency phone dialing instructions, test kits and reagents. We've done CPO vouchers. So we're really trying to help our stakeholders gain compliance with the MAHC requirements. And so again, even after giving our stakeholders these incentives, we had a couple different responses. On the left-hand side, we had individuals say, hey, like, just tell me what I need to do. We'll go forward. This is great. Let's change these things. And then on the other side, you'd have the deer in the headlights. I didn't know there was a MAHC adoption. This is news to me. Those individuals didn't come to stakeholder meetings, didn't check emails or snail mail. So it's hard to make everyone happy, but overall our reception was pretty good. Then I'll go ahead and pass it on to Scott for the rest of our presentation.
All right, thanks, Autumn. So what are some of the best practices and lessons learned that we have gathered throughout this journey in adopting the MAHC? So the biggest one, I think, is to get your stakeholders involved early. We made a really large effort in the beginning to educate our operators about the changes that were coming, why we were pursuing those changes, what the expected timeline for the implementation of those changes would be, while at the same time, we were fostering partnerships by soliciting support from our Board of Health, our county legal team, as well as working with those other local health departments and our state health department, who were also looking at updating the regulations at that time. So we really weren't out there on our own doing it. We were soliciting those opinions all the way across the board, which was very helpful and helped lead to a lot of buy-in by our stakeholders. So we also provided them with ample opportunities for collaboration and feedback. We had, as Autumn pointed out, several stakeholder meetings. We put out newsletters. We did the surveys, and we really wanted to identify those challenges that they would have so that we could help assist them in overcoming those challenges so that they could go forward and this could be a positive for their operations, as opposed to the negative that oftentimes regulation changes or increased regulation is perceived to be. And then we also wanted to be sure that we were sticking to our deadlines and we had clear expectations for ourselves for how we were going to go about this process. And we were really helped by that in the grant support that we received, both from the Pool and Hot Tub Alliance and then also from the CDC and from NACCHO, and the help that we got from all of those partners that, you know, they give you those nice deliverables that then you go from an internal deadline, which can easily be pushed because we have lots of other programs that vie for our time and our attention, versus those external deadlines that really helped us keep on task and also dedicate the staff time to be in order to do the work. So having that funding available that actually allowed us to put FTEs or full-time equivalent hours in place for some of our staff to do that work was really invaluable. So next slide. So what are our next steps? So we are definitely not done with the revamping of our pool program, our recreational water program. We want to continue improving it, and we want to continue reducing the risks to the swimmers in Pueblo County. So we really do want to reach that goal of those national closure rates for our pools and spas, and we're pretty hopeful that we can get there. So one of the things that we're doing right now is we're working on a pool safety and U course. It's based on our food safety and U course, which we've had for several years, which has been very successful. And the courses are designed to help operators gain some basic skills and knowledge that they need to run a safe operation. This doesn't replace a CPO course or the need for a CPO, but oftentimes a CPO is not necessarily the person doing the work at the facility. So we really wanted to come up with a course that would help those folks who are doing that day-to-day pool operation really understand what they were doing and getting into, as opposed to, when they run into a problem, calling the CPO, because by then you could have a serious incident on your hands if somebody's doing the wrong thing, which could result in an injury or a tragedy. And to this point, we actually had a recent event happen at one of our facilities where there was a mistake that was made when one of the operators was adding some chemicals to the pool, and it resulted in a violent chemical reaction. And thankfully, no injuries, but it did require hazmat response to that facility. And so one of the areas that we are focusing on is bringing more additional hazmat training, both to our inspectors and make that training available to operators as well. It's very easy for people to get cavalier with chemicals. They're working with them every day, and they're not really harmful, right? We put them in the water and everything's fine. We swim in it. And these chemicals can be very volatile and very dangerous when not handled properly or a simple mistake happens. So we want to bring some training in to help with that. We're going to repeat our survey and kind of do a pulse check with our stakeholders. We're in the process of doing that now. We've gotten some initial responses back. But we're hoping to get a lot more with that. So check in and see how they're doing and see what we can do to help them meet these new requirements. And then we're also in the process of really doing a deep dive on our data, which Autumn has shared some of that. Our inspection data is, now that we have 1 year of inspections kind of behind us, and really help do an entire program evaluation that will help direct the program to address those issues now, which are at the top of our risk analysis, which weren't there before. So lots of exciting things coming soon. So next slide. And so a couple of basic takeaways from this experience, which we hope will assist all of you as you go back to your jurisdiction and your facilities. And they're pretty straightforward, but they're all important. Don't reinvent the wheel. I think this was the thing that we really appreciated with the MAHC. Its strength is that all the hard work was really done for us. The groups that have worked on this for a really long time have done all that heavy lifting. And so it's very easy for us to take that forward to our Board of Health and have that backing for why we wanted to make these changes. And we have the opportunity as stakeholders in that process to provide our feedback to those folks who are revising the MAHC. So it really lays it all out there for you. It's ready to go, which means it'll take less time to implement. That being said, it is still a process to implement regulation changes. And so definitely need to stick to it. We had the additional challenge of doing this during the pandemic, as Autumn said, which definitely slowed us down. But still, from beginning to end, when we really started to research changing the program, it was about 6 years until we actually got the MAHC adopted and then implemented into our daily inspections. But definitely, from what we're seeing already, it was well worth that time and the effort that we put into it, because we were improving along the way as well. So it wasn't just a one and done thing. That entire process was very helpful. And then you're not alone. Agencies like NACCHO, the CDC, the MAHC committees exist, and they have lots of resources to help you as you explore this adoption in your jurisdiction. You can check with other state and local health departments and see if they're interested in pursuing that same goal, or they're doing that work, and you can partner with them. And then we're also happy to continue to talk with folks one-on-one. As Autumn said, we'll be at NEHA, so we'll be there. That'll be another opportunity, but our emails are available and our contact information, so you feel free to reach out with us to us at any time, and we're happy to share any resources that we have and talk through any of the challenges you may be seeing. So, and then just keep that end goal in mind, which is safer swimming. That's what we all want. We want to avoid incidents like the ones that we unfortunately have seen here in Pueblo County. And at the end of the day, that's what everyone wants. That's what our operators want. That's what the regulators want, and that's what the public wants as well. So, so yeah, the MAHC is a great way to get to that point. So that's our talk for today. So I'd like to just acknowledge all these folks. I'd like to thank NACCHO and the CDC for giving us this platform and all the support they have for our program. I'd like to take a moment to thank our pool team members, both past and present. These are the folks who were working in the program during the time since we really started this. So currently, Robbie and Julian are inspectors who are actually doing the field work now. Chad is our program director. Vicki Carlton was our program manager previous to me taking on the program. And then we have our past inspectors, Dayton Ryden, Corey O'Connor, Megan Collins, and Captain Garvey. We do want to thank our stakeholders and our Board of Health, as well as HS GovTech, for giving us a great platform to really track our data and generate the reports we need. And then NEHA and the CMAQ, as well as PDPHE and the Colorado Swimming Pool Group, who did a lot of work on revising regulations as well, and we're a big help in that process. And then we also want to thank the Pool and Hot Tub Alliance for awarding us that initial Neil R. Lowry grant, which really helped kickstart this. So at that point, we'll address any questions you all may have. Thank you.
Well, thank you so much, Scott and Autumn, and really congratulations to you and your team for this incredible work of so many years to get where you get now, but always involving your stakeholders, also documenting this and getting all the data. So it's incredible to hear. So we want to continue to tell our participants here to submit your questions via the Q&A box. We know we're getting close to 3 o'clock here in the East Coast, but what we will do, Rebecca and I will compile all these questions. We'll follow up with Scott and Autumn, and then we'll put together a Q&A document that we'll share with you following this webinar. So please continue to submit. We have great questions that were submitted, but we wanted to kick off with a very interesting question related to, first, if you encounter any issues when you were going through this process, since you adopt the MAHC, where you were now in conflict with your state regulations. And then one participant asked that, they understand that Colorado Department of Public Health and Environment is now looking into adopting the MAHC statewide. So if you're working with them throughout this process, so if you have anything to share related to that.
So yeah, no, we can jump into. So the good thing is when the state enacted the rule to allow the local municipalities to adopt the Model Aquatic Health Code by reference, that really eliminate a lot of those barriers where we would be in any kind of risk of being in conflict with the Colorado regulations. So for a lot of those discrepancies, really, we're able to take the same approach that we do with a lot of the state regulations, where as long as we're more strict than the state on a particular item, then the local regulation really wins out. We can't be less stringent than the state, but we can be more stringent. And so we really haven't run into any issues with that or our other local codes. So we just handle those the same way. If the building department has a particular code that's more strict than a code that we may have under the MAHC for an aquatic facility or for a facility that happens to have a pool in it, then that code is going to win out as well. So So that's been a big help with that. We really haven't encountered that often at all. And then, and then for the second part, yes, we definitely have been in touch with the state. They've reached out to us to kind of talk to us about our experience as well, and so we've communicated with them, and we're happy to discuss with them as much as they want about our process and the issues that we saw as we went through it.
Great. So we'll do one more question before we wrap up the live portion of this. And like Daisy said, we'll answer the rest after this. So our next question is 2 questions combined. So one person asked, how many variances have you issued? And another asked, how do you define an undue financial hardship?
Did you want to answer this one, Scott? Or... So with the variances, we've had, trying to think about 2 that I can remember off the top of my head. And those were regarding like kiddie pools or small wading pools where it didn't make sense for them to pay thousands of dollars to have an automated controller, an automated disinfectant, and pH feeders. So we were able to allow that that variance as long as they were testing it adequate times. Yeah, we haven't had too many variances at the moment. We've done a lot of like chemical room and equipment room waivers. Again, as long as they can follow certain criteria to make sure that their chemicals and like non-pool equipment and chemicals are very well separated from each other, that there's no water lying around, and again, that there's no crossing paths of equipment and chemicals that don't belong together. So yeah, we haven't had too many variances. An undue financial hardship is really, again, it depends upon the facility and what they are capable of doing. Again, maybe a chain facility that has a lot of venues and across the nation, maybe they have more money to make these changes, but then you have a nonprofit who can't make these thousands of dollar upgrades if they, again, don't have an automated controller and all those feeders all at one time. So yeah, it depends on the facility, honestly, as what's an undue financial hardship.
Great. Well, thank you all. We wish we could stay here. There are many other great questions, but like we said, we want to be respectful of everyone's time, especially our panelists. So we really want to thank you, Scott and Autumn, and your whole team for this incredible work. For those that stayed with us until the end, like we said, we'll compile all these questions. We'll follow up with you in an email. And also keep an eye on it. As Rebecca said at the beginning of this presentation, we are documenting all this process that Pueblo County went through. We're collecting some resources from them. So we'll be putting all this together and we should have it available probably towards the beginning of September. So we'll share via our communication channels. Please continue checking our webpage. And yes, look forward to your emails. Then we hope to see everyone here in our next webinar. And thank you again and enjoy the rest of your day. And this will close out our webinar for today. Have a good rest of your day.
Thanks, everybody.